I am so excited to have Nat and Nic here today on the Empowered in Health podcast. They are an incredible resource in the perimenopausal hormone health space. And this is going to be jam packed with incredible knowledge, incredible information. And I can't not wait for you guys to hear more of their perspective, story, all the things. Thank you so much for being here today.
Thank you for having us. We're pumped to have this conversation.
Yeah, of course. This is such a needed conversation. The information is so necessary for women. And I'm just so grateful to connect with both of you and to hear more of your perspective and your expertise. So I'd love to dive in and just share a little bit more about the work you do. I know you both work in functional medicine, naturopathic medicine. You work primarily with women inside women's health, perimenopause, menopause, hormone health. And I'd love to start with talking a little bit more about perimenopause and what are the key signs and symptoms that you see in your patients or that you see in the women that come to you. And what are the things that you coach women through as far as what they could pay attention to or what they should really learn in this stage of their health?
Yeah, so there's it's a broad sort of signs and symptoms that women can experience. One of the most common things is cycle changes.
Yeah.
So women who used to have sort of a regular 28-day cycle, clockwork is now all of a sudden starting to bounce around a little bit.
Yeah.
So we'll see that. We will see mood changes. That's really, really quite common. We will see sleep disturbances. We will see brain fog, body composition changes, weight gain, fatigue, libido changes, and then the hot flashes and night sweats.
Right.
And I intentionally didn't talk about those at the start of that list because that generally, that always gets the headlines. That's what everybody talks about. Perimenopause and menopause equals hot flashes and night sweats. When the reality is there's so many other signs and symptoms.
Yes.
And a lot of those others and hot flashes and night sweats generally happen later in the transition.
Yeah.
And I think it's those mood changes and sleep disturbances that we need to talk about sooner because this is where women get dismissed.
Yeah.
Oh, you're a busy mom. Life's too full.
Right.
Manage your stress.
Right.
And in fact, there's some hormonal fluctuations that are really at the core of this.
Yeah, I love that you're sharing kind of the sequence of what you see and how you want to really coach women with understanding how the symptoms can slowly be uncovered, because you're right. So often we're dismissed, but we also kind of dismiss ourselves. We kind of justify, I'm just busy. Oh, I just didn't sleep well. And it's so powerful when you start to connect with knowledgeable practitioners like both of you who are saying, you know what? No, this is not the norm. This doesn't have to be where you're living or how you feel in your day to day. And if you're uncovering this series of symptoms, it's very real, related to hormonal imbalance and the depletion of our hormones as we get into this midlife season. And so I'd love for you to maybe speak a little bit about your personal experience with perimenopause. I have my own story that I'm happy to share too, but I'd love for both of you to maybe speak a little bit about what you've seen in your own physiology.
Totally. So we're both 41, so just sort of in our early 40s and are absolutely stepping into this season.
Yeah.
Certainly the mood changes before my period are very evident. Sometimes sleep disruptions. I joke that I have this new onset hot flash every time I have caffeine, which is special and fun.
Oh my gosh, it's so real.
Worse before my period. I'm I went shopping a little while ago. I'm I am dying. My body telling me to cool it on the caffeine.
Totally hear you.
For me, it's the mood changes. And I'm so grateful that I work in this space that I was able to identify why this might be happening. Mood changes and cycle changes. Usually very predictable. Now way less predictable. And accompanied with some of those mood changes. And so it's the weird anxiety out of nowhere or the just feeling blah. And again, could very easily chalk that up to just life at this stage.
Totally.
Being busy, having young kids, all the things, but starting to see a little bit of those things peeking in.
Yeah. And I had kind of a combination of both of you. But mine was absolutely the mental health component. The mood, my anxiety and my low mood felt debilitating. And it was just so unlike me, especially because I really do work hard to try to prioritize my health and and come up with habits that I know help me feel better. And I got to this point in my life where it wasn't working anymore. No matter what I was trying to implement, it wasn't adding up and it wasn't really helping me feel better. And so I love that you kind of talk to the different sides of your personal experience, because there are different levels of symptoms that women just need to be aware of and not necessarily normalize. One of the things that I've learned is the difference between normal and optimal. And I'm sure you speak about that all the time, because so often, right, all day long, so often we're going to the doctor or we're talking to a practitioner about our symptoms, and they're just classified as normal, right? This is normal, or your blood ranges are normal, or this is quote unquote in the normal realm. And there's just a big difference. And once you know better, you can do better. And so I'm so glad you're here to just share your knowledge. I would love to speak, kind of top line about sex hormones specifically, because I think women, we haven't necessarily been educated on the depth of how our sex hormones change as our physiology changes. Mm-hmm. And so I'd love for you to speak a little bit about, estrogen, progesterone, testosterone, why we need to start to understand what those hormones actually do inside our body, and then essentially how they play a role with symptoms inside of perimenopause, as they start to deplete, as the ratios start to change. I'd love for you to share a little bit about the impact and how that can play a role.
Yeah, for sure. So we know that estrogen and progesterone, when we're cycling regularly, have a very predictable sort of ebb and flow throughout the month when our cycles are really regular.
Yeah.
Progesterone peaks after ovulation. And in perimenopause, when ovulation might not be happening every cycle, or our hormones are starting to bounce around a little bit, we might not get these optimal levels of progesterone.
Right.
And progesterone really has this like beautiful calming effect. It's great for our moods. It's great for our sleep. So this is where we'll start to see those mood changes and those sleep changes, typically right before our period. Now I say, let me just blanket, like nothing in perimenopause is overly predictable. It's a very unpredictable time. So that's the textbook thing that we will see, but that's not always how that translates for a woman. But we will see that like sort of that new onset sort of insomnia right before your period, or that onset of anxiety like Nic was talking about.
Yeah.
And then estrogen really plays a role in terms of our moods. It can play a role in terms of like our bone health, our vaginal health. The hot flashes and night sweats are because of that declining estrogen. So we will start to see that estrogen decline. And testosterone starts to decline around this time as well. And we'll see that in terms of like libido. That's a big one for women. So we'll see that drop. Now, libido is very multifactorial. It's not just take testosterone and this will get better. There's lots of factors to consider when a woman has low libido, but we will certainly see that as well.
Yeah. And it's something that I never knew. I really, truly never really understood not only what my hormones were doing necessarily throughout different phases of my cycle and how that essentially played a role in symptoms or how my body felt, but I didn't really know, especially in midlife health, until I started to get educated, until I started to really understand, like you said, progesterone is a huge calming factor. It's one of the hormones that is huge for managing our stress or helping us feel a little bit more stabilized on the mood side. And I just never had that knowledge. I really was never taught that growing up. I was taught you're going to have a period at some point. Your physiology is going to change as far as your body. And here's how you get pregnant or not get pregnant. It was not like this in-depth education around here are the different hormones and here's what's happening at each point of your cycle. And here's how they can play a role in how you actually feel. So I really appreciate you kind of sharing that, because it's just powerful.
Yeah. And on that note, I just think it's so wild. Like we teach women or young girls so much about puberty, yet we've dropped the ball to educate women about their physiology as they enter in their 40s and 50s. And we're left sort of scrambling to be like, why do I feel this way? And then at 40, we're learning about, the cycle variations that are happening in our reproductive years. If we could just educate young girls who are moving through this, like imagine how much different their teenage years would be and maybe their 20s and how they would show up. And
yeah, it would be so different, which is why I appreciate the work that both of you are doing, because it's so important. So I'd love for you to talk a little bit about just what you're doing in your practice related to education, relating to how you support your clients. Talk a little bit about the work you do.
Yeah. So a big part of what we look at is we look at the whole patient. We look at their habits. We look at how they're moving, how they're managing stress, how they're eating, what phase they're at through this journey. And we talk to them about how we want to be showing up in all of those different aspects. Nutrition needs to change. The way we move might need to change, or may need to be doing more. We talk to them about how to manage their stress. And we also talk to them about their options when it comes to hormone therapy.
Yeah.
So some women are great candidates for it, and it can be a beautiful therapy for helping them to navigate some of these turbulent times. And so we will talk to them about that. But I love what you said about optimizing somebody's health. And that's really the work that we do, is making sure that we are not just, one step above deficiency, but that we are really truly setting them up for great health today and into the future. That's another big thing that we work with, is the decisions or habits that we make in our 40s and 50s can have a huge impact on how we age into our 7th, 8th, and 9th decade. And so really laying that foundation for women as they're navigating midlife, so that they can navigate that phase with strength and independence and thriving through that time, not just, surviving and being alive, but really being independent and able to do all the things they want to do.
That's so good. And I think such a powerful reminder for us in this season, because I think what happens on the mindset side for women is you kind of move from, maybe more of aesthetic goals in your 20s and 30s to this is now longevity health.
Yes.
This is now preventative mindset. This is setting myself up for how I want to age gracefully.
100%.
Yeah.
Yes. I did a whole Instagram post yesterday about that. Just like, we need to make a bigger why, especially when it comes to exercise. It's no longer about the aesthetics. It's no longer about that. It needs to be so much bigger than you. It needs to be about maybe your kids, or how you want to age, and how do you want the next whole bunch of decades to look like. And I think we have this pivotal point at midlife, which is, Nick and I get really passionate about this. And like, we're going to either take one of two roads. And the beauty of this is like, this is in your power.
Yeah.
When we talk about strength training, I'm like, you can build muscle at any age. Like, that's so cool. So it doesn't, this isn't something we had to start in our teens. We could pick up weights at 70 and still change our health outcome. And it's so exciting to really sort of help women set the stage for their health as they're moving forward.
Yeah, that is it's so good. It's so important to remember to just encourage women in that way. Because I think, we've all probably experienced some level of, here's the one size fits all, here's the aesthetic focus kind of strategy around health and wellness. And, when you get into this midlife season and you're starting to really learn more about physiology changes and hormonal health changes, it really does matter. Like you said, making your why bigger. I love that. That concept is so important for our longevity wellness. Mm-hmm. Yeah. I'd love to talk a little bit about body composition change, because this is a big one. Nick, you talked a little bit about, habits, and really thinking about how are we looking at the big picture? How are we evaluating wellness from this holistic lens? And for me on my own journey, and really even with the clients I work with, body comp change is a big one. And we just talked about how, 20s and 30s, maybe we were more aesthetically focused. Maybe we're really, doing things for a specific reason in those seasons. And as we get into this season and our body comp changes and there's hormonal fluctuations involved, that's a big one for women.
A big one. That drives them into our office a lot of the time, right? Because it's all going to our abdomen.
Yeah,
right? We're losing that influence of estrogen. And so estrogen puts weight in our hips and our thighs. Yeah. And that is left. And so now we get this deposition of extra weight, and it's all in our abdomen. And women hate it. Yeah. They really don't like it. And aesthetically we don't love it, but it also carries a much greater health risk. And so that's why I get so excited about talking to them about it. It's not because I want them to lose that, because I want them to get into a certain size, but because that carries a greater health risk when it comes to their cardiovascular health and their metabolic health. And so we need to care about it. But we need to care about it, like Nat said, in a deeper why, not because of her size, but because of what that means for our health. So we have that. There's like so many things that happen at midlife. Like there's the hormonal shifts that will influence like where we're holding weight. But we also see this as just like that meets aging. And with aging, we have a loss of muscle mass. Right. So our muscles are a metabolically active tissue. Mm-hmm. The more muscles I have on me, the more calories I'm going to burn, the more flexibility I get with my nutrition. As I'm losing muscle mass as I get older, I'm now less of a calorie burning machine. So what I see, and this like pains me when I see it in my office, is like this woman who's coming in who is just doing more cardio and more cardio and more cardio and cutting calories and cutting more calories. And is in this sort of like I'm starving myself to try and get rid of it. And it's the complete opposite of what we need to do in this season.
Yeah.
And that worked for her at one point. Right?
I know. Right. It worked for all of us at one point. Right. I mean, one of the most incredible things I've learned on my own journey and what I work through with my clients and the women that I speak to is the unlearning. Like the unlearning we have to do in midlife is probably the most profound work we have to do, because we've been marketed and shared with work harder and eat less. Yeah. And we aren't always focused most on things like strength training and really getting adequate fueling and all those things. And so there is this level of understanding that what we were once doing probably isn't going to serve us anymore. Totally. So I'd love for you to talk a little bit about what are the things you focus on from a fitness and nutrition standpoint for your clients or for the women that you serve. What are the things that really do truly help move the needle on symptoms, on body comp, on longevity wellness when you're working with people?
I think one of the most important things is addressing their nutrition, and it's increasing their protein.
Yep.
Women notoriously are not eating, or people notoriously are not eating enough protein. And protein is what we need to maintain our lean muscle tissue. Right. And so shifting the ratio in our diet to be more protein forward, shifting the focus to just what you said, fueling the body. Right. Like it's less about what we're not eating and more about like what we get to have and how we get to eat and how much and volume that we actually need, and really setting the stage for protein adequacy is probably the most important thing that I am correcting in most women's diet plans today. And with that change, there's also the adaptation of, we need to make sure that that's not at the expense of fiber. Because sometimes I find when we adopt that initial shift of like, okay, I'm going to eat protein, we do it at the expense of our other macronutrients, which are equally as important. Like we need to have fats, we need to have carbs, we need to have that fuel and that sustainability. So we need to make sure that we're getting sort of that like fiber adequacy as well.
Totally. Yeah, it's so imperative. And on the fitness side, what do you coach people through, or what do you really, connect your clients to as far as what matters most when it comes to movement?
Yeah, I think, we get so focused on in movement, often just one thing. Right. Women are often coming in and they've done cardio forever, and we're talking to them about, you have to prioritize strength training. If we want to have lean muscle tissue, if we want to be strong, if we want that metabolism to be revved up and reduce our risk of disease, we need to be focusing and prioritizing that lean muscle tissue, which happens with strength training. But it also needs to happen with cardiovascular exercise, with stretching and mobility work. So in fitness, when we're talking to people, it's not a this or that. Yeah. It's often a this and that. And I think sometimes the messaging online gets very confusing for women at this stage. So I love the work that you're doing, coaching women, talking to them about this stuff, because I think it's so important to just cut through the noise and really come up with a balanced fitness plan, a balanced nutritional plan that is going to support them today to reach their goals, but also into the future.
Yeah. Yes. I love that, because it's so loud. It's so noisy. It's so loud. It can feel so confusing. And we've kind of lost our way a little bit because of all of the information that's shared. And I just think it's so incredibly important to keep normalizing this idea of taking care of your wellness for your longevity health needs to be really bio-individual to you. And it needs to be strategic, and it needs to be in this way that's hormone supportive in this season of your physiology massively changing. I love that you're continuing to really work with your patients in this holistic view, because I know that, I've talked to women myself. I've had my own experience where I've gone to practitioners or I've gone to doctors, and it's not the holistic view. It's not this inside out wellness perspective and lens. It's really this almost like a Band-Aid kind of approach where we're not going deeper root cause, and we're not looking at the different facets of our habits and how we're actually managing different levels of our wellness. And so I love that you really coach women through this idea of, we need to be looking at the big picture.
Yeah, I say this patients, like the health. We're in Canada, and the healthcare system, I always say, is designed to get you to the line of fine.
Yep,
fine, everything's fine. And I say we pick you up from the line of fine and walk you along this path of optimal health and wellness. And so that's really the role that we play for a lot of our patients, is just moving the needle forward and just making sure that they're not just symptom free, but that they're as healthy as they could be.
Yeah. I know, Nick, you talked a little bit about how so much of our habits are around this concept of also disease prevention, like getting ahead of chronic illness and really getting into that preventative long-term longevity health mindset. So I'd love for you to talk really quickly about not only the nutritional and movement components and how that plays into really getting ahead of chronic disease or chronic illness, but also things like hormone replacement therapy or the options that you offer to women. Can you talk a little bit about why those things and getting educated about those things can be so powerful for how you feel long term?
Yeah, for sure. Like I think that it's cool as naturopathic doctors, I always say we have a lot of tools at our disposal, which is really
Yeah.
great. So we can use some hormone replacement therapy, but then we have all of these lifestyle and nutrition and elements that we can utilize, which is so great. I think baseline blood work every year is a really great idea. We should do that as part of our wellness plan and our longevity plan that we should have blood work done. In Canada, you can get baseline blood work, but then sometimes we have to pay out of pocket for different things.
Yeah.
In the U.S., I know it's a little bit different, but make that a priority. That is key to like uncovering some of your biochemical imbalances or nutrition imbalances and
Hmm.
moving you towards that optimal health.
Yeah. I
Yeah,
love that. So
yeah.
important.
And then in terms of like the habits and some of the other things that we can do, like sleep, we need to prioritize sleep. We need to
Yeah.
prioritize rest. We need to prioritize stress management. We can't burn the candle at both ends and keep go, go, go and expect to
Yeah.
have, thriving hormonal health. And I think sometimes this, hustle culture or the narratives we get into, it's really empowering women that it's okay to take a break.
Yes.
It's okay to need rest. You
Yeah.
don't need wine to get through your day. You don't
Right.
cook a healthy
Yes.
meal. It's okay. Have your wine
Right.
at the end of the day.
Right.
Like, no, maybe our life is a bit stressful and we need to look at
Right.
that.
Right. Like rest is a part of the program.
100%.
And it's just got to be this vivid reminder, and always like giving ourselves permission to flip the script on that, because we're
Totally.
so programmed to feel like we have to keep going, we have to check all the things off the list, we have to just make it work, make it happen. And I know for me, that's what led to me totally crashing and burning on my health. I just wasn't paying attention enough to not only where my body was at and how my physiology was changing, but I was also trying to really maintain this pace that just led me to complete burnout, because I wasn't being mindful enough. And I know that this is a really big struggle for so many women. So I love that you spoke on that, because it's
So
so important. It's so
yeah, so
important.
patient this week, like she was really struggling with her energy and she was really struggling. And I said, what would it look like if you just took like Sunday off
Yeah.
and you just did nothing?
Yeah.
And she's like, I'm like, what would you tell people you did on Sunday? She's like, well, normally I tell them all the things I accomplish in a day.
Yeah.
It's like, what if your accomplishment was rest?
Yeah.
Like, how would that feel? And it's like, we had this beautiful conversation about just giving herself permission
Yeah.
for that, as how she would give that to all the other people in her family and her
Yeah.
friends. And it's really about just granting yourself permission to
Yeah.
have that. And it's okay to do nothing. And it's okay to listen to your body and to
Yeah.
rest and nourish yourself. And
Yeah, women need that. Women need that reminder. They need that permission. They need like that person to just kind of nudge them in that way. And it's so important to continue to do that work, because it's going to continue to help women shift how they feel, especially in this season and for longer term health. I'd love for us to chat a little bit about the person that's listening to this, the woman that's listening to this, that's resonated a little bit. She's heard your perspective, how you work with different women related to their symptoms. Maybe she has some symptoms. Maybe she has some things that she's curious about. What would be your best advice to that woman who wants to figure out, how do I get started with getting support, working with a knowledgeable practitioner, doing testing? What would be the first step you would share with her?
a really commonplace I always say, because this will help your provider, whoever you get connected with, is just start tracking your cycles and your symptoms.
Yep.
Start tracking. Just start making notes. It will become clear to your provider, if they're knowledgeable in perimenopause and menopause, whether or not this is hormonal or if this is not.
Yeah.
But tracking that can just give you a lot of clarity and feel a little bit empowered.
Right.
I think when we're having regular cycles and our cycles are really predictable, it's really easy to like anchor into that.
Yeah.
And be like, oh, I'm tired, but I'm 2 days from my period. Oh, my moods are off, but I'm a day from my period.
Yeah.
When our cycles start to bounce around and we don't have that anchor, it can feel really out of control. So just having that and just like writing that down can be so, so helpful. And then find a provider who is knowledgeable in terms of perimenopause and menopause.
Yeah.
Somebody who can hold your hand, can do the blood work that you need, can do the assessment that you need, and really help you understand where you're at in this transition. Because I think with the right support, and Nick and I are big advocates of this, like with the right support, you can truly thrive.
Yes.
Like your 40s and 50s can be like awesome decades
if
you do the right support, not just like crawling you through the end of this hormonal turbulent time.
Yeah. Yeah. And I mean, I've experienced that firsthand, how there was a moment late 30s where I felt like it was over. Like I felt like this is just how I'm going to feel. This is just the truth of the matter of my health evolving. And my eyes have been blown. Like my mind has been blown too by what happens when you get connected to knowledgeable practitioners that really understand the hormone health lens, that really understand female physiology, and that can help you thrive. And so I love that you really spoke on that, Nat, because it's just imperative for women to understand, like, you don't have to just survive through your day. You don't have to survive through this season. And so it's just incredible to continue to get connected to practitioners that really are doing this deep dive work for women's health. I'd love to quickly move into my last couple questions here. You guys have been amazing on just sharing perspective and really encouraging women to understand that you should feel really good in your days. And so one of the things that I like to ask on the podcast is more centered around this idea of maternal mental health. I am a huge believer in advocating for mental health. You know, my personal wellness story has been driven by mental health. Often, like, I've had different levels and seasons of really intense mental health hurdles. And so I want women to always feel encouraged and empowered, and to understand that there are other women that have likely experienced some level of what you've experienced in your health. So I'd love your perspective on this, as far as sharing our stories, talking about what works for us. Why do you feel like that's so important for other women and moms to hear?
Oh, I think it's so important. I think we see it day in and day out, and it's been really obvious to us in our one-on-one practice. Is I'm having these conversations with one woman at a time, and she leaves, and then the next person comes in, and we're having a very similar conversation, yet they each feel alone in their journey.
Yeah.
And I think that it's so important for us to talk about what's happening, normalize these experiences so that people know that they're not alone.
Yeah.
And I think when we can hear someone like yourself who's talking about your journey, and you're like, listen, I navigated this, but look at how well I'm thriving today, gives us hope. You can help to educate people or point people into the right direction so that they can experience just what you're experiencing, right? And so I think we do healthcare like in a one-on-one context. That's just the way that healthcare has been delivered for decades.
Yeah.
But today, luckily, we have different platforms and different offerings where we can share these stories and hopefully provide hope for women.
Right. Do you offer any kind of group coaching or group opportunities? I'm just curious.
Yeah, we do. We have our Perimenopause Playbook, which is our group program where we have an element of individual teachings as well as group support with us, which is like, it's magic. Yeah.
I'm sure it's magic.
And share their stories and hold each other accountable and tell them how they're doing it and what's worked and what hasn't worked. It's like, it's pure magic.
And so do you do that in your clinic, or is it virtual?
It's virtual.
Okay.
It's virtual. Yeah.
That is so
awesome.
awesome.
Not in the context of one-on-one care. So we are able to deliver that kind of anywhere in the world, essentially.
That is so awesome.
And that's our way of not doing it. Just, I would say I can only help, 8 people in a day if I'm doing it one-on-one. But if we step out of our offices and have these conversations on a bigger platform, we can help so many women, because so many women are struggling.
So many women are struggling. I love how, Nick, you talked about how each person kind of came into your office, but they were simultaneously feeling the same things. And how when we're in a group or we're normalizing conversation here on podcasts or doing coaching in some capacity, we can really break down that wall. Because that's one of the hardest components, I feel like, sometimes in midlife health, is feeling so isolated. Like, I must be totally crazy on an island. And that's just not reality. So I love that you shared that, because it's just profound for women to understand. We're probably simultaneously feeling similar things. We just need to keep normalizing talking about it.
Absolutely.
And continuing to do that.
Social media is like, doesn't help us either, right? We see them and we think they're thriving and everything's perfect. I'm like, well, maybe they have a lot of support in the background, or maybe we're not seeing, they're just seeing the highlight reel. And so I think it makes us feel even more so alone when we see some of these different images online too.
Yeah. Yeah. And that's a great reminder for all of us that it's never really necessarily exactly what we see or what's shared,
Yeah.
and why it's so important to continue to make sure you're getting surrounded in very dedicated places with people that are like-minded, that maybe can really, relate to what you might be experiencing. So as a wrap up, thank you again for being here. This is a question that I love to end with. I love to kind of dive in and hear everybody's different perspectives. And this is kind of more around the mental health side and just this concept of how do we remind ourselves the importance of taking care of our own wellness? When we're busy moms, we're busy women, we're trying to make sense of midlife health, we're trying to manage different kinds of things. What is something related to a quote or a mantra or some sort of scripture verse or something that speaks to you specifically and gives you that nudge and that reminder of how important it is to take care of your wellness?
Yeah, mine that I always share with patients, and I even use it in my own life in terms of my own self-care and well-being and health, is just progress over perfection. We can get so stuck and lost in this plan has to be perfect and I have to execute it this way, when it's really about just taking one step forward. Just showing up at the gym is going to be better than staying at home, even if the program isn't perfect.
Right.
Prioritizing your nutrition. So I always say progress over perfection, and don't get like lost in the perfectionistic weeds that we can all get pulled into, because then we don't move forward and we get paralyzed and we don't take the step.
Oh my gosh, it's so good. So important. And I love that because it's a good one for me. It's a good one for all women, because we totally get stuck in the perfection of we have to have it all figured out or it has to go this way. And that's not real life.
Never.
That's not real life.
Yeah.
Would you quickly share, how can people find you if someone's interested in working with you, the work you offered? I know you talked about the Perimenopause Playbook. Just share a little bit about how people can connect, how they can find you online.
Yeah, you can find us. We're pretty active on our Instagram, so at Dr. Nic Nat, and our website, drnicandnat.com.
Perfect. Thank you so much for your time today. I have no doubt this is going to serve women in such an incredible way, and I'm so grateful for your time. Dr. Nic Nat, thank you so much.
Thanks for having us. Thank you.
Take care. Thank you so much for tuning in to today's episode. I know balancing time and energy can be a challenge, and I'm so proud of you for listening in and investing in your wellness journey. I feel incredibly grateful to connect with you and for the opportunity to share more knowledge, stories, and encouragement related to all things wellness. I would love to hear how this podcast has served you. If you enjoyed today's episode, please subscribe and leave a review on either iTunes or Spotify. Your support truly means the world to me and helps me reach more women just like you and me who are looking to transform their health from the inside out. Plus, when you share this episode with a friend, we invite more women in to learn alongside us. What a gift. Remember, knowledge is power, and the more we know, the better we can do. For ourselves, for our families, and our future. Well done on taking the step towards a healthier, happier you. Until next week, stay empowered and stay well. I am so excited to have Nat and Nic here today on the Empowered in Health podcast. They are an incredible resource in the perimenopausal hormone health space. And this is going to be jam-packed with incredible knowledge, incredible information. And I can't not wait for you guys to hear more of their perspective, story, all the things. Thank you so much for being here today.
Thank you for having us. We're pumped to have this conversation.
Yeah, of course. This is such a needed conversation. The information is so necessary for women. And I'm just so